Good morning. Today is Saturday, the 29th of August, 2020, and I'm looking at this one source from Johns Hopkins where they present critical trends, and the one that interests me the most is the impact of opening and closing on state decisions. So my running hypothesis is that because of super spreader events where people get together in close proximity, it doesn't have to necessarily be a house party at a college, but it could be a bar where people are just getting together there in close proximity. Those are where all these coronavirus cases initiate. Once people leave those events, the spread from person to person is much less likely because people don't tend to, in general, be in close contact with multiple individuals, which increases the likelihood of spread. So my belief personally is that when you eliminate those events, because of policy or because people decide not to go to these super spreader events, you have a decline in the spread of the coronavirus. Now, I cannot be obviously sure about that yet. That's something that's difficult to test. I'd like to be able to do it. But this graphic from Johns Hopkins is good. It shows what the impact of opening up is versus having restrictions and closing. So I'm looking at Arizona, and this shows cases per day. And this is closing, this is opening, and this is opening that's decided by county. So they say defer decision to county. So it's just kind of interesting to see what's going on here. You can see early on there were very few cases in Arizona. Then later on, even right after opening, but then they increase a lot in July, which is a very hot period there. It's a very dry state too. So that may have an impact in some way on the virus, but that's something that's different from what I'm looking at. But then there's this big decline again. One reason I think there are declines is that when people see that there are massive increases in the virus, they tend to start behaving appropriately. There tends to be a reduction. We have to look at that juxtaposed to deaths, and we can see that there's an uptick in deaths here, although there weren't massive amount of deaths per day in Arizona. You had up to at the worst you had let me see if I can find, you had 91 here, went up to 147 deaths in one day. Again, the most vulnerable people are the ones who will be dying, which makes sense, especially in that super spreader theory, because people are spreading it and then they're going back home and interacting in close contact with their loved ones. So that would increase the likelihood of the spread. Let's take a look at California, because that's another state that's been hard hit. So let's go back to confirmed cases. Again, you had serious restrictions followed by some opening and intermingling between restrictions and opening up. California in general has been a very restricted state, or at least nominally, so that means in name only. But you see they had an increase again in the number of cases, and then they're having the same decline again right now. So again, I think that's just, again, I'm saying again a lot, right? It's my belief that there's this reckoning with the truth and reality when people notice that they're helping to spread a virus. The deaths have been kind of slowly increasing. We haven't had this massive increase like we see in other states, which we'll get to now. So we did California, Arizona. Let's look at District of Columbia, my hometown. Lots of restrictions. We still had increases during the restrictions, which is odd, right? You'd think, well, with massive restrictions, people shouldn't, but there's all these other gray events here, other events. Not really sure what those mean. They're just called other. So who knows what those were about. I can't remember the dates of the protests that we had. And these might be related to the protests. So this could be super spreader events. Here we had openings, and people seem to be behaving really well. And then there was a slight increase here, so obviously there was a reaction to that. So they've done, in general, a pretty good job overall. And with deaths were highest during this period, and we saw that coincides with whatever these gray events are. Again, I don't know what the dates of the protests were, the massive protests we saw. And then we had a declining in deaths here. At the peak, there were, well, it's a smaller city, so there was fewer deaths than, say, in a major state, obviously. So let's look at Florida. It's all everybody's favorite, right? Florida, where everybody goes out and parties, doesn't worry about anything. During restrictions, we had very, very few cases. In a relaxing of restrictions, we had a big increase in cases. And then now there's a decline again. So again, I think people are starting to realize, wait a minute, let's start behaving well. So my belief with this hypothesis is there's a tendency for people to have a reckoning and to reduce the spread once it occurs, which is very important because we're seeing this in sport as well. When we started baseball and soccer, basketball and hockey, even tennis, you saw these clustering of cases. They're like super spreader events, or a clustering of cases, people getting together and doing whatever they do. And then we see a decline because people decide, hey, we have to behave well, otherwise we're going to lose everything that we're working so hard for. So in Florida, you had an uptick in deaths, 225 in one day. And as a result, perhaps of this opening up right here, it's really hard to say, but again, transmission occurs when people bring the virus into a closed space and we're in close contact with others. And for the vulnerable, this is a problem, obviously. Let's now go down to New York, since obviously New York is was one of the early hotspots. I've heard the governor of New York claim that they've done an amazing job. Well, actually, that's not true. Let's be factual about that. This doesn't look like an amazing job to me. Now they've done a good job afterwards. And see, even having some openings and minor restrictions, you see the number of cases has decreased greatly. There's less and less propagated transmission. So you have these, whatever was going on here, perhaps super spreader events, well, New York is like a super spreader event. There's just a giant number of people. If you ever gone walking around New York City, there's hardly any room to walk without running into another person. And obviously this coincided with a great number of deaths, and for a while there, the majority of all deaths were in New York. But this is probably a data collection anomaly here for some reason. And then we had decline, and deaths are very rare right now, which is amazing. Very, very happy to see that. So, again, to me means that there is tendency to learn how to behave appropriately in order to preserve life. We need to preserve life. This isn't a joke here. A lot of people think the coronavirus is a joke or it's fake. Well, ask the people who've been sick. Ask the healthcare providers who've taken care of them. Ask the biologists who actually look at the coronavirus under a microscope. What do you think? They're just like inventing stuff? I mean, it's not fake. It's there. Our response to it is what dictates what happens. So, responding correctly, we're, as Dr. Fauci likes to say, flattening the curve, right? This is deaths in New Jersey. You'll notice that they've opened up here. So, if you behave appropriately, opening up doesn't harm people. Opening up, wearing masks in closed spaces. I still see people not wearing masks when they should be. And it just like drives me insane. I was at a Wegmans the other day in Montgomeryville, and this young man was walking around with the mask on his chin, nose exposed, mouth exposed. Everybody else is wearing masks. You keep on hearing announcements about wearing masks. And I gave this guy a look. It's not like I was angry. I was just like bewildered to see that somebody would be in a store not behaving appropriately. To me, it just doesn't understand. It's not like we don't have people telling you to do this all the time. And again, I said at Wegmans, they actually broadcast this over and over again and tell you, hey, if you don't have a mask, come and get one. We'll provide one for you. Let's look at Louisiana. Louisiana has been odd because they've had these peaks. Now, you think about New Orleans as this massive party capital where people are walking around Bourbon Street and just having doing all kinds of nefarious activities, debauchery, whatever you want to call it. Well, you can see that we had uptick in cases, lots of restrictions, but this was even during restrictions. And again, there's these little, I wish I knew what those were, but I could consider them super spreader events. Then we had freeing of restrictions and massive number of cases again. Let's take a look at deaths, how that worked together. More deaths in this early period. Now, one of the things I think about deaths, and this is just, again, it's a hypothesis, is that we have, in the beginning, people didn't know what was going on. So they exposed a lot of people who are vulnerable to the virus, and those people unfortunately succumbed to it. Now, they may have already, in most cases, in the majority of cases, people do have comorbid conditions, and coronavirus may have or hastened the death. But it's not the only reason people die. But there were all these vulnerable people who were, if they would catch the virus, they would be more likely to die. So you saw that happen. But after that, you see all these very, very vulnerable people are already dead. Now, there still are obviously vulnerable people who haven't been affected because many people have stayed at home. That's why we have to keep up with these restrictions. But we are seeing that in general, the more restrictions we keep, the more we practice social distancing, particularly from the vulnerable, there's less likely we're to have these great upticks in deaths again. So that's what we'd like to be able to see. I want to pick one last state. Let's look at North Carolina, because they had this, they shut down North Carolina University of North Carolina because of this super spreading event. I don't know if this is going to be available yet here, but at least we can get an idea of what's going on in North Carolina. Yeah, so they've had a more recent uptick in cases after the relaxing of restrictions. And let's see how the deaths have gone with this. So they're still struggling with it. So they're still affecting vulnerable people. To me, this is just not paying attention to the data. I mean, at some point you have to pay attention. I know there's a lot of news coming up from people, those who belittle it, but you can't help that. In public health, all we can do is provide the data. And thanks, John Hopkins, we are able to see some really, really interesting stuff. I want to thank you for the moments you shared with me. Have a good day.